A male patient, aged 42, who was involved in a paragliding accident, is being brought to the Department of Emergency Medicine in Bern by helicopter. The emergency department is very busy this morning, but they still need to work quickly now. The nurses in triage, who are responsible for assessing the medical severity of emergency patients, needs to quickly decide how urgently each of the patients needs to be treated. Even before the helicopter has landed, the triage staff have deployed a team of specialised staff, a consultant, assistants and nurses from the emergency department, as well as staff from anaesthetics, orthopaedics, radiology and other specialists. The specialist staff are already awaiting the patient in the trauma room. This is where seriously ill and severely injured patients are treated.
We primarily look at the injuries that could be life-threatening. We start with the airway, whether the patient is still breathing, or how the lungs look, how the chest looks, whether the respiratory system is still working, what with all the injuries that can occur there. Then we move on to the circulatory system. We look to see whether someone is bleeding or if there are any other circulation problems. Only then we do assess their consciousness, that sort of thing. The things that are most likely to kill a person need to be assessed and treated first. The shift manager organizes which station the patients arrive at. We have a station A and a station B. She also informs the personnel present if a patient is arriving in the trauma room. She decides who to send there to help and support. Once we know that a patient can be moved, she looks for a bed in the department. She's primarily responsible for organization and selectively supports staff at the stations in cases of urgent need. The nurses on the station take care of the patients. That is to say, they monitor them. Standard monitoring consists of ECG, blood pressure and saturation. They administer the prescribed treatment and help the doctor with diagnostics. They take blood samples and send them to the laboratory. They accompany the patients to radiology. They manage the patient's treatment by injecting medications or whatever is required.
An employee of Bern Cantonal Police is in emergency bed 2 after being admitted with a gunshot wound to his left leg. The projectile from a 9mm pistol is lodged near his shin bone and needs to be removed.
Our clientele, especially on Friday and Saturday night, is sometimes very specific. It may be that they are inebriated or have taken drugs, or that they are aggressive for psychological reasons. They come to the hospital for help, but they don't let us do anything to them. They refuse everything, they throw things about, they spit and they insult us. It is very difficult for our staff to treat such patients.
A patient in bed 12 is keeping the staff in the nurses' station on their toes. She is currently refusing all treatment and wants to run away. Security is called in along with a psychiatrist. The patient is then admitted to the crisis intervention ward as an inpatient.
Sometimes we are asked when a patient is allowed to come to the emergency department. The World Health Organization, WHO, has given the following definition. An emergency is any situation where either the patient or a bystander thinks that immediate help is needed. It's therefore the patient himself who defines if it's an emergency or not.
The emergency practice at the Department of Emergency Medicine is a walk-in practice for outpatients with non-urgent medical problems who cannot reach their GP or do not have one.
The
patients who come to us sometimes have trivial sports injuries. For example, they have twisted their ankle or burned themselves on a hot teapot, or they have a sore throat, fever. They don't really have such severe breathing difficulties or illnesses that they need to lie down. They arrive on foot, they are called walk-in patients after all, and usually they go home on foot as well.
Here at
the emergency department, we have a relatively high number of patients from migrant backgrounds. They come from the Arabic region, Africa and Asia. They are not familiar with our GP system. So they come directly to the hospital with minor medical problems, and we have problems with linguistic communication because of their nationality. We see many patients who are unsure of their medical history. They sometimes do not know what medication they are taking. When we ask them about it, they say, "I take the big red tablets or the little white ones," which doesn't help us, of course. In certain circumstances, we have to try to reach a patient's GP by telephone if they are available, or look in old medical records if the patient has been to the hospital before. All of this to find out which illnesses they are suffering from or which tests have already been performed.
The
patient is usually here for 1 to 2 hours, depending on whether we have to carry out any investigations, which takes time. For example, we have to wait for test results so that we can decide whether we need to perform an X-ray. Then there could be a wait for the X-ray, but usually the patient is discharged after 1 to 2 hours.
Nach 1 bis 1,5 Stunden ist wieder so, dass heimgehen kann.
The Department of Emergency Medicine at the Inselspital Bern, which was first opened in June 2012 with its 3 helicopter landing sites, 3 trauma rooms and 29 centrally monitored treatment stations, is one of the most cutting-edge emergency departments in Switzerland. But in spite of all the modern technology, there are still situations which can be stressful for the staff.
Of course, there are situations every now and then which are more difficult to deal with. On one hand, when there are friends, relatives there, and you have to explain to them that their husband, wife, friend, or whoever has died. And then, on the other hand, we often see many unpleasant sights when it comes to severely injured patients. For example, patients with severe facial injuries.
To round off its diagnostic facilities, the Bern Department of Emergency Medicine has some ultra-modern radiological equipment. For example, a low-doc scanner in the trauma room makes it possible to radiologically display a patient's entire skeleton within just 3 minutes.
This primarily helps us to narrow down the injury pattern somewhat in terms of broken bones. Whether it's a lung injury or an injured pelvis, these are very sensitive injuries. The system helps us to show within minutes what injuries a patient
Die
has.
wichtigsten Sachen auch schon in ein paar Minuten zeigen.
An incredible wealth of technology in the trauma room. But where is the personal attraction for this sort of work?
The main attraction of the work is the flexibility it requires. When I come on duty, I never know what the day will bring. Only afterwards can I actually say what happened. And working together with all these people, specialists, our own team in the emergency department, the anaesthetists, the radiology team, that's a very exciting challenge.
Vom Röntgen und so weiter, das ist eine sehr spannende Aufgabe eigentlich.
Für mich ist es wichtig.
For me, it's important that I'm involved during everyday life as well.
Ich habe diesen Betrieb
I got to know this place as a junior doctor, and I am also a part of the day-to-day operations of the consultants.
der Oberärzte teil. Das ist ganz
That's
wichtig,
extremely important, so that I get to experience problems, conflicts or shortcomings early on and at first hand,
frühzeitig erkennt und auch
so that a solution can be found.
erlebt, damit man sie dann
In a service such as ours, where we have such a close relationship with each other, where we have to rely so heavily on each other, we are almost always on first-name terms.
so sehr auf der eine auf den anderen verlassen müssen, sind
We can express our opinions freely without the various hierarchies preventing us from doing so.
auch direkt dadurch die Meinung sagen, ohne
That is, in my opinion, something very special for a university hospital, but it's what makes us special and particularly popular.
Teil, aber das macht uns auch speziell.
We are also
Das macht
proud of our informal yet respectful interactions with each other.
uns auch alle sehr stolz auf unseren ungezwungenen, aber dennoch respektvollen Umgang miteinander.
So, jetzt geht's nicht mehr lang.
Whenever possible, the Department of Emergency Medicine allows relatives and/or carers to be with the patient during their treatment and care.
Etwa 2/3 der Patienten kommen zu laufen.
Around 2/3 of all patients arrive at the desk on foot. With conditions such as heart attacks, which you can't see immediately, but you can see that their heads are soaked with sweat, for example. That's when we immediately inform the triage staff.
This is where patients come when they are initially examined by a nurse in triage. The nurse then determines how urgently the patient needs to be treated. Do we need to act immediately? Is it a life-threatening situation? Or do we still have time? Can the patient wait? In many cases, waiting is a problem for patients, as they see the patients who have come in after them are being treated before them. We get some patients who get extremely angry. Our job is to identify the priority of the patient's condition, and the patients are then treated accordingly.
Patientendaten sind wichtig.
Patients' records are important so that we can clearly identify the patients. We have to make sure that one patient does not suddenly become two patients in the administrative system. We always ask the patient for their health insurance card first, which we then use to identify the patient and make sure that we have the correct data in the system. The quality of the patient data is important because, as the main system at the Inselspital, the administrative system provides many other partner systems, such as the laboratory, X-ray, etc., with patient data.
So korrekt abbildet.
Also, Frau Schweizer, dann gehen wir jetzt auf den Stützpunkt.
Last week, we had one day when we experienced a record high of 164 patients. We have 29 beds on the station, so with 164 patients, we can work out for ourselves what is the maximum time a patient can stay in the emergency department and how quickly we need to work. Depending on the severity of the condition, there is sometimes not just one, but two nurses looking after a patient. So for a heart attack or a stroke, for example, there are usually two nurses on the scene. That's also the case in the trauma room. We therefore need a sufficient reserve of staff on each shift to ensure that we can meet demands. If the station is full, the nurses have to free up personnel resources so that the most severely ill patients or high-risk patients can be looked after in the trauma room or in the emergency bed 1.
Oder in die Notfallkoje, Koje 1, wo sie die schwerst kranken Patienten oder Risikopatienten betreuen.
A patient suffering from a stroke has been flown in by Swiss Air Rescue. According to the patient's GP, she has already had a stroke in the past. However, she has remained independent until now and has not yet needed any blood-thinning medication. For the senior physician in neurology, Professor Urs Fischer, all of this is important information. After examining the patient, a decision is made as quickly as possible as to whether the patient can be treated with thrombolysis, a medication which would dissolve any blood clots.
So einen Betrieb mit
To keep such a service with almost 45,000 patients a year under control requires extremely good teamwork.
unter Kontrolle zu behalten, braucht es eine sehr, sehr gute Teamzusammenarbeit.
I always compare our work here with working at an airport, where there are a wide range of different areas. Areas where airplanes arrive and depart and where all the guests need to get to their various gates. It's just like that for us as well. Patients arrive, they stay here with us for a while, and we have to make sure they get the right flight, so to speak, or in other words, that they are correctly diagnosed, that they don't have to wait too long and that everything goes smoothly in between.
Diagnose kommen, dass sie nicht allzu lange warten und dass zwischendrin alles gut funktioniert. Neben der Patientenversorgung haben
In addition to patient care, we also have another task which we call teaching and research. We teach a great many medical students as we are a very popular teaching institution. A lot of students come to us from Switzerland but also from abroad to get an insight into emergency medicine. Our research is also a little different from conventional research. We don't carry out laboratory research in the traditional sense, but our focus is more on so-called healthcare research. This means that our areas of interest are often selected from lifestyle-related topics. We look at issues such as cycling, electric bikes, sports accidents, domestic accidents, and that sort of thing. I sometimes joke that if our research gets in the news, that means it was a good piece of research, because then people will understand what we are doing and what we want to say.
Und was wir sagen wollen.
30-jährige Patientin nach einem Velounfall mit einem Schädel-Hirntrauma in einem aktuellen GCS von 11.
Das ist richtig so. Wir sind ungefähr in 10 Minuten in Insel.
Als wichtigen Ausgleich zu meiner Arbeit tue ich sehr viel Sport machen.
I do a lot of sport, which is important to me as a counterbalance to my work. I'm an avid sailor and I like to get out on the lake at every possible opportunity. Otherwise, I also like cycling, swimming or hiking, and that helps a great deal to relieve the stress that you experience, even as a doctor in the emergency department.
I have a second home in Oberengadin in the Alps, where I am a member of the SAC Bernina Alpine Club. I enjoy mountain climbing both in summer and winter. My passions are ski tours in the winter and alpine tours, climbing and hiking and biking in the summer.
I sing and yodel, and at home on the farm. I have a farm catering business which I host. My employers have allowed me to reduce my workload to 60%, and after 30 years of service, I am very appreciative of that. I'm working at full capacity and am completely fulfilled at home too.
I play sports as a counterbalance to my work. Mountain climbing, paragliding, kind of risky activities. But I also like to go for walks with my husband and my dog. You name it. I always make sure to try and find a balance.
Also für mich gibt es ein sehr starkes Privatleben, das ist meine Familie.
I greatly value my private life. I dedicate almost all of my free time to my family. If I ever want just to switch off, I listen to music. And people think all physicians-in-chief listen to classical music, but that's not the case for me. I prefer something a little more solid, like heavy guitar music. When I was young, my favorite band was Nirvana, but I also liked Metallica. They are bands that I'm still very close to, and they are always playing on my iPod.
Immer noch auf dem iPod laufen.